Hi, you guys. Welcome back for our daily practice questions. It is day 126, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And make sure you click the subscribe button so you don't miss out on any of my videos. Question number one states, a screening test with high sensitivity is most useful for, is it A, confirming the presence of a disease, B, ruling in a diagnosis, C, ruling out a disease when the result is negative, or D, estimating treatment effectiveness? Take a moment and tell me what you got. All right, so in this case, the stem is the question is the stem, right? So it states a screening test with high sensitivity is most useful for what? And so your best answer is C, ruling out a disease when the result is negative. And let me explain why. Remember, sensitivity has two T's, so think positive. So it is going to let you know the positives. It rarely misses someone who has the disease. So when there is a negative, it will help you to rule out the disease because it doesn't miss the positives. It's highly sensitive, okay? Question number two. A diagnostic test with high specificity is best used to A, rule out a disease, B, minimize false positives, C, maximize sensitivity, or D, screen asymptomatic populations. Take a moment and tell me what you got. All right, again, STEM is the question is the STEM. A diagnostic test with high specificity is best used to, and the answer is B, to minimize the false positives. Remember, specificity is the more negative, right? So remember, sensitivity has the two T's in it. Think of plus signs, it's positive, whereas specificity will correctly identify those without it, the negative. So, right. So that helps you to eliminate the false positives because it's more specific. The ones that are more sensitive are going to get everything positive. So sometimes you can get false positives. So that's why it is better utilized to rule out those when there's a negative because it's going to catch all of the positives. Do you understand what I'm saying? And so the ones that are more specific help to reduce the false positives because it's going to highlight those negatives. It's more specific, all right? And I put it in this format because if you see it on a question on boards, they can deliver it like this and it gets confusing. So I need you to think of what the term means, but what the approach is of these research models and testing criteria. And one more. Question number three, which of the following test profiles is best for a nurse practitioner to use when confirming a diagnosis after a positive screening result? Is it A, high sensitivity and low specificity? Is it B, low sensitivity and low specificity? Is it C, high specificity and low sensitivity? Or is it D, high sensitivity and specificity? Take a moment and tell me what you got. Look, I need a reward for being able to say that without getting tongue tied. All right, all right, all right. So here we go. Which of the following test profiles is best for a nurse practitioner to use when confirming a diagnosis after a positive screening result? So when you're trying to confirm a diagnosis, especially after a positive screening result, C would be your best answer. You want it to be highly specific. and low sensitivity. Remember, the sensitivity are the positives, but because it captures all of the positives, you can have false positives, right? So low sensitivity, but high specificity, because if the specificity is high and it captures the negative, you will know which ones are a true positive. It will allow you to confirm a positive screening result. High specificity, low sensitivity. And just to run it back, sensitivity has two T's. Plus sign, positive. These are your positives. Specificity are your negatives, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.